it was a bit of a journey to get to addiction medicine. And most of that journey had to do with distinct dislike of my job in the emergency department and trying to understand why there was a subset of patients who I had such difficulty understanding and dealing with and working with. And after about 2 years of full-time work out of residency in the emergency department, I wanted to quit. And I hated it. Showing up to work was a drudgery. And most of it was because the things that I had been trained to do in inner city Philadelphia, fix stab wounds and gunshot wounds and super sick, complex patients, it wasn't what I was seeing. Even though it was a level 1 trauma center, it was not a knife and gun club. It was mostly blunt trauma, people in car accidents. But what I ended up seeing all the time was people who were suffering. And I had no idea how to explain it to them. I didn't know what to do with it. And quite honestly, I wasn't a great doctor for them because I was frustrated. And I probably wasn't terribly interested at that point. I was just irritated that I couldn't identify the cause. I couldn't identify a fix. And as a doctor, we like to fix things. And so I asked for Wednesdays off for 6 months and started seeing those patients that were in the ER 10 or more times per year randomly on Wednesdays. And I just asked them as I would see them on my regular shift, hey, if you want to come in on Wednesday, we can try to figure out what's going on and identify the issue. Interestingly, about 95% of them showed up without, a whole lot of prompting, which by itself is, really was surprising. They would come through the snow and on the buses and wheelchairs to get to be seen, which had not occurred in the emergency departments or in their primary care experience. But what I found was this subset of the patient population suffered from addiction and chronic pain and a lot of these suffering issues that, that we had to deal with on a pretty regular basis. And that drove me to start to learn more about addiction. So I went to a meeting and really enjoyed the people there and the subject matter. And my history of kind of being a neuromolecular biologist from graduate school allowed it for me to understand the neuroscience pretty easily. And it was fun. And so I continued on that as well as pain medicine.